Good afternoon, everyone. Good afternoon. We'd like to start the next session. Hello, I hope you had a nice lunch and you had a great workout. My name is Patricia Blomqvist. I'm a liaison, among other things, and I'm very happy to introduce the next presenter, Dr. Terry Harville, who is going to talk to us on alternative therapies. And a lot of patients have questions about that, and myself included, so I'm looking very much forward to his talk. Here's Dr. Terry Harville.
Thank you for the introduction, and I'd like to thank the foundation and Lisa for inviting me to present to you. And I need to, how do I advance my slides here? Green button. And what I'm going to be talking on, actually, they sort of abbreviated the title, but it's complementary and alternative medicine. And so this would include a variety of things that I'll be explaining as we go along in the next few minutes. And so as that implies that there is the good, the bad, and the ugly that goes along with these. And so let me get started to tell you more about what we're going to be really talking about. First thing I'd like to do is I'm not really an expert in this area, but I keep getting asked to give these talks. Whenever you want to deal with something that is an alternative to the approach that you're taking, it's really best done with on a one-to-one setting, and particularly with your physician that's involved with your care. When you try to do it in front of an audience, you're not covering everything that people are are interested in knowing about. And because it's really a very short time, it's hard to go through and talk about everything that needs to be done. Don't do this without having your healthcare providers involved. You really need to talk with your physician before you do anything that I would discuss today, so that you know it's not going to interfere with or create a problem with your therapy otherwise. As another note, I've told Lisa that I'm going to be giving a copy of this to her so she can put it on the website. So at the end, you can go to the website and be able to pull down the talk if there's anything that you've missed along the way. We'll go through explaining the terms that are involved with complementary and alternative medicine, or CAM. I give a little case presentation to illustrate some points. We'll go through and highlight issues with minerals, vitamins, amino acids, and so forth as we're discussing below. And ultimately, we'll end up summarizing things in the end. Complementary and alternative medicine is a term that refers to healing approaches and therapies that are not based on the mainstream or part of the conventional allopathic medicine that we're involved with. So most of the time when you think of this, you're thinking of it in terms of what goes on with not the Western type medicine, but the Eastern type medicine, such as what you'd see in China, for example. Complementary medicine refers specifically to unconventional practices used with mainstream medicine. Alternative usually involves the unconventional practices that are used with the mainstream medicine. So complementary, for example, would be adding things like physical therapy to a workload, whereas alternative would be adding supplements or minerals or other things to the care practice. Integrative medicine is another component of all this, and it's specifically tries to use all these approaches together to the betterment of the individual patient. And so this is a concept that many are trying to do these days to try to come away with something that's better for the patient. The term homeopathy is something that is used a lot these days, and the original way homeopathy, the term, what it means is to take and think about a substance that causes symptom. For example, if there was an herb or something someone would eat that would cause vomiting, then what one would do is take and dilute that in water to a very, very, very tiny amount with the concept that it would prevent vomiting. And so the problem with all this is that when you dilute it down as much as it's diluted, whatever was in there is no longer present. And so what people that truly practice homeopathy in its full meaning, they will describe that the water retains the memory of the substance that had been present in there before the dilution, and that memory effect is what leads to the benefit from it. I find it a little bit hard to swallow myself. Therefore, what I'd like to say is that traditionally, if someone is using the way homeopathy is traditionally described, there's really no benefit. Today, though, homeopathy is using a totally different term. It's been co-opted to mean issues with sort of home remedies or with things from nature otherwise rather than the dilution effect. So there may be some validity if you go to a store and it says these are homeopathy type things, but you need to always make sure that you're not just getting diluted water, because you pay a lot of money for just water in that circumstance. What most people, I think, are after are consideration of natural remedies or things that are from nature rather than are otherwise processed, and that seems to be a big thing for many of us these days. And something that is known to otherwise help with the healing properties. And so, again, back to thinking about traditional Chinese medicine, that's what would come to mind when most people are thinking about something that involves a natural medicine approach. And that's where things like the herbs and other materials that can be mixed and concocted together in some manner that can provide some benefit. Some things to think about with complementary and alternative medicine is when you go on the internet or you're otherwise approached about it, generally it's sold through testimonials rather than through some type of rigorous scientific testing. And that has, in and of itself, problems because it's easy to sort of use this approach to try to make a profit because people are looking for something to help them because they have problems. And if the conventional medicine, the Western medicine approach that your physician's been trying you is not working, it's very easy to fall prey to what we'd call con men or snake oil salesmen. They're selling you a cure-all that will cure everything from dandruff to athlete's feet. And that type of approach, especially via testimonials, is not the way to select the types of therapeutic interventions that one is going to utilize. Again, it's very easy to fall effects of the snake oil salesman that are telling you you have something that is going to cure all when the modern approach, the allopathic approach that you're using, hasn't been successful. And when we think about things in our Western medicine, while most of the concepts have been around for a while, many of the things are relatively new. For example, antibiotics have only been used for 60, 70 years at this point, whereas the things that are involved in traditional medicine or traditional Chinese medicine have been used for thousands of years. And so there's issues to always consider about when we're thinking about the utilization of this approach. The natural products have been there through various forms of trials and selection. People have found that something works, and then this has been carried on by lore, and people would become traditional medicine or natural medicine shaman or other types of things that would provide benefit and all. And overall, many of these things are good, but there's very little regulation. This industry is not regulated by the FDA, and so one of the other issues is that the label, what the label states, may not be what you're actually purchasing. So again, you have to be aware of what you're trying to purchase and not buy something that is not what you want or need, because you may not be getting what you're actually paying for. And in the last couple of years, the state of New York went through and tested a variety of supplements from different manufacturers, and some of these very reputable manufacturers, and found out what was in the bottles what they found in the bottles was not what the bottle stated. And in some cases, there are ingredients in the bottles that could cause harm to individuals. So one always has to be aware that whenever you're buying something that is listed as a alternative or natural medicine or complementary medicine or homeopathic medicine, that what's in the bottle may not be what the label actually states, or what the label states may not be actually what you've found in the bottle. Well, I want to go over sort of briefly, and thinking about this whole scenario is a little case, and it started with about an 8-year-old boy that had juvenile arthritis. Just to let you know, my primary profession is I'm a pediatric immunologist and rheumatologist, and I deal with patients that have primary immune disorders and rheumatologic disorders or autoimmune disorders. And so this is a patient I saw many years ago. And at that time, we used aspirin as our mainstay of therapy for juvenile arthritis. The mother asked me, could she use white willow as a natural remedy rather than aspirin, since white willow had been used for generations as, to help deal with arthritis problems. So we made arrangements to talk with the manufacturer. So all of us had a conference call together where we could discuss what would be needed from the white willow bark that they sold to treat this child. And at that point, the amount of aspirin would have been around 40 baby aspirin a day, or about 10 adult aspirin a day. And the manufacturer did his calculations on his white willow bark about the salicylate, which is what you're wanting from that. And basically, to get enough white willow bark, the salicylate from it, you have to basically brew a tree a day. And one thing that would be cost prohibitive, thousands of dollars a day just to get enough aspirin to treat the child. But he was very concerned that the other chemicals present in there, if you were trying to do this, could be very harmful. And so it was very nice that this person, which was very reputable, obviously by his comments, basically he told the mother that she should just use regular aspirin rather than trying to use the alternative therapy. And so those are the type of people you want to be dealing with when you deal with this type of an area. And so even though a natural remedy may have an ingredient that would be useful for therapy, it may not come in a correct form, and it may not have enough of it there to provide you what you need. And there may be toxic material with it. So again, one always has to educate themselves about what's going on so that they can be aware of what they're trying to do. Let me go into the minerals for a few minutes and just mention some that may be useful, and talk about, again, the good, the bad, the ugly with these things. And so useful, we know that getting iron, calcium, magnesium, and so forth is listed, are very necessary, and most of these hopefully are obtained in your diet, but sometimes people need extra because of losses in their GI tract, or because they've lost blood or other reasons for it. Some of the other ones that we need in minor amounts because for our enzymes to work better include things like selenium and vanadium and chromium. But any of these, taking too much can actually be harmful. And so you can damage the liver if you get too much iron or too much selenium or vanadium. And chromium can even damage the DNA if there's too much of that around. So one always has to be careful about overdoing it when you're also replacing or taking some of the supplements that are needed. A balanced diet typically should provide most of what needs here. And a physician can do laboratory testing to determine if extra iron or copper or any of the other trace minerals are needed, and that so that you can be taking it in appropriate amounts rather than overdoing it. Another thing regarding minerals is calcium, which is an important mineral that we need. But taking calcium by itself isn't very useful because you need magnesium as well as vitamin D to get absorbed and get into the bones appropriately. And so just taking calcium by itself is not as helpful as taking it with the extra material. One of the problems with calcium, though, is in the last few years, the American Heart Association says that calcium supplementation in older individuals is not good because it results in heart attacks. And then just in the last couple months, there's a report that came out that said calcium supplementation in somewhat older women resulted in, there was an association with dementia. They were very careful to say there's no cause noted that they can't say that it does cause dementia, but it's just an association, and therefore that someone should be talking to their physician carefully about the need for supplementation. And so as we get older, we need the calcium to prevent osteoporosis, but are we also inducing further problems with cardiac disease or with dementia? And so we have to, again, be careful about our needs and make sure we're doing this the right way so that we don't create harm. Another mineral that is very useful is zinc, and this is absolutely required for wound healing. And for example, the reason that animals lick their wounds is so they can activate zinc to get the enzymes that are associated with wound healing to start working in there. But if you want to, you can join a lawsuit for the manufacturers, against the manufacturers that produce the dental paste to hold the dentures in, because there's a claim that there's the zinc in there is creating problems in individuals, although I can tell you that's a lot less zinc than what you usually supplement patients with type thing. So there's always a good side and a bad side to any of these things that we're discussing. Vitamins, B, C, and D, folic acid are some of the most needed vitamins that we have. So the B vitamins have multiple purposes. Because they're water soluble, generally there's not a problem. If you take too much of them, your body just excretes what you don't need. You don't store these, so that means you're needing to constantly replenish those. And some of the people have said that the Americans have the most expensive urine in the world because, again, of all the B vitamins that we urinate out because of the supplements we take. B12 is a very important vitamin, and it's very important for neurologic as well as muscles. And many people, it's not absorbed very well. And so many of the patients that I deal with, we recommend that they take monthly injections rather than try and take oral B12 because they may not be getting as good benefit. Sublingual forms of B12 may be helpful in some individuals, but the injectable form definitely gets it into your body that the others may not. And if you want to have the B12 to do its job appropriately, you really need to have folic acid with it to make sure that you're getting the full benefit from it. An interesting thing about vitamin C is Linus Pauling took 10 to 12 grams of vitamin D each day, and he thought it was needed for good health, prevent cancer, prevent infections, get better tissue healing. And you know, he was a pretty smart man. He actually did win 2 Nobel Prizes, which is more than anyone else has done. There have been many studies performed, though, that say that vitamin D or vitamin C does not prevent colds. But none of those have used the 10 to 12 grams a day that Linus Pauling did. Generally, they're giving about half a gram to a gram a day. And one of the other things is drinking orange juice is not a very good way of getting vitamin C into you, despite the advertisement that tells you such. You don't get very much vitamin C through orange juice. So if you're really wanting to supplement, you have to take vitamin C capsules or pills. The problem with vitamin C is that in high doses, it can cause your stomach to be upset. And that can cause a lot of belching and burning feelings there. For most people, a gram a day will not hurt you and can be helpful. And like the B vitamins, vitamin C is also lost in the urine, and so it doesn't build up in the body. And so therefore, if you're really trying to get some beneficial effect, you really have to be taking every day. But like all these other things I've been discussing, before you embark on these, you want to talk to your physician that's managing your care to make sure that they do not disagree with you taking these things where they're concerned it may interfere with their management of your condition. A and E vitamins, these are important vitamins in addition, but vitamin A, while it's needed, is not very good taking it as vitamin A. Vitamin A actually can cause arthritis to flare up and cause problems. And so it's better if you're wanting to get to receive it as beta-carotene, where it's metabolized to the appropriate forms that are useful in the body and not harmful. Vitamin E is manufactured, and it's because of the way chemicals are made, they're made in like mirror images of each other, and it turns out the mirror image form of the vitamin E actually creates harm in our body. So taking vitamin E supplements, taking the capsules of vitamin E, may be not as good as it should be because you're getting the beneficial part as well as a part that can be potentially harmful in some individuals. So again, eating green leafy vegetables and getting the vitamin E and beta-carotene from the orange vegetables is probably more helpful than taking these as supplements. Vitamin D. When I was in medical school, we were taught there's a condition called hypervitaminosis D, and that you should restrict the supplement of vitamin D. Now, some of that was based on cod liver oil, which many of you probably know about, and it was probably other things besides the vitamin D than the cod liver oil that was creating the problems rather than the vitamin D itself. And there have been many studies that have shown that really, really very high doses of vitamin D do not cause harm in anyone. And in my email, I get the newest articles that come through on various things. And almost every day, I get a new article on vitamin D and how it's being used for asthma, arthritis conditions, autoimmune disorders, kidney disease, et cetera. Almost every day, there's something about a beneficial effect of getting more vitamin D into someone. The RDUs, so what the FDA, based on studies in white mice, said that 400 units a day was what was needed. But we know that that's way too low to provide any benefit. And that 800 units is used in a lot of supplements. And again, that's way too low to provide any beneficial pharmaceutical effect. Most of the studies that find benefit are using relatively higher doses, so 2,000 or 3,000 a day, up to 10,000 a day, and even, in some individuals, 30,000 a day. But before you'd ever take more than the RDU, you need to talk to your physician and make sure that they agree with you taking vitamin D at these larger levels. The maximum benefit from vitamin D, once again, is going to be when you add the calcium and magnesium to it. So the vitamin D is carrying out its function and what it's using these ions for. And this is, again, something you should definitely talk over very carefully before embarking on it. One of the things that was noted more than 30 years ago, that vitamin D receptors are found in T lymphocytes, and it was always unclear why they're there. And indeed, we still don't know why T cells have vitamin D receptors. T lymphocytes are what control the immune system function. And so what we do know is that vitamin D helps regulate T lymphocytes into a better fashion. So that's why using the right types of doses of vitamin D can help in a variety of autoimmune type disorders that we found. Somehow it's capable of regulating the T lymphocytes to work more appropriately, although we still haven't worked out exactly why that occurs. Niacin is an interesting vitamin because it helps with your cholesterol metabolism. So it does a job as good as the statins. A gram a day can cause the bad cholesterol to go down and increase the good cholesterol. Most people have problems with the flushing of the skin, and so that limits its use in some individuals. But if you take the niacin with food in your stomach at night, usually it doesn't create a problem. The slow-release forms, interestingly, don't help the cholesterol as much. So buying a slow-release niacin is probably not providing anyone any benefit. There's a lot of concern about potential liver toxicity with taking niacin at levels of a gram a day. And so again, this is something that would need to be discussed very carefully with a physician before embarking on its use to help control cholesterol levels. Amino acids. Amino acids are another thing that is naturally part of our diet. When we eat our protein, it's comprised of amino acids. When we look at the amino acids, the most relevant and most essential one is called glutamine. There are many other ones that are important and essential, meaning we have to get them in our diet, that our body can't make them. But there are 2 or 3 other ones that are probably helpful as supplementation. So example, arginine, lysine, and then cysteine, but cysteine, particularly in the form of N-acetylcysteine, or sometimes called NAC. And this one acts as an antioxidant, which is very helpful in a lot of conditions. And it helps prevent some of the degeneration of tissues due to the oxidative effects. As you can readily see, that glutamine is the most important part of the metabolic chart. It's in the center of all our metabolic pathways. It leads to the appropriate metabolism of glucose, the appropriate metabolism of fats, as well as the appropriate metabolism of amino acids. And so glutamine is something that is very useful as a supplement to take. Glutamine is required for cells to grow in culture. So anytime we do experiments where we're trying to grow cells in culture, if we don't add glutamine, the cells won't grow. And also, glutamine is the only supplement that has been shown to actually boost immune function. So all these things that you read and where they'll say makes your immune system work better, all this kind of stuff, that's not true. The only thing that has been able to be shown to do that is actually glutamine. And in some inflammatory conditions, for example, like inflammatory bowel disease, taking 2 to 4 grams of glutamine a day has been shown to provide dramatic benefit in reducing the bowel disease in those individuals. And some of the people are able to stop some of their more immunosuppressive agents when they do that. So once again, if you're thinking about using this as a supplement to your medical approach, you need to talk with your physician and make sure that they do not disagree and feel that would be harmful to your therapeutic care. Arginine is another interesting amino acid because it's metabolized to nitric oxide. Nitric oxide is what's used by our body to make our blood vessels dilate. So taking arginine can cause your blood pressure to go down. It can cause your airways to work better. And it can increase the blood flow to various tissues. So the heart gets better blood flow, the brain gets better blood flow, your muscles get better blood flow. And so arginine supplementation is very good and typically not a problem for most individuals. Lysine is another interesting thing from a supplemental standpoint because lysine is required in the building blocks of our body. So the components that are helping to provide the integrity, the tissues that hold our body together, lysine is required because it cross-links the different proteins to each other to add to the tensile strength to make our tendons, the ligaments, our integument much stronger. Lysine also helps with healing of mouth ulcers. So lysine can be very useful in a lot of individuals. And acetylcysteine is one of our essential, the cysteine is one of the essential amino acids because it contains sulfur, and the sulfur is required in a variety of metabolism. And cysteine can be metabolized to another amino acid called methionine and vice versa. The other thing about N-acetylcysteine is that it helps to increase the S-adenosylmethionine, which is our natural antioxidant in our body. And this is what's required to keep our oxidative metabolism under control, prevent oxidative damage of our tissues, and the supplement of N-acetylcysteine is relatively inexpensive versus trying to supplement with S-adenosylmethionine. But the N-acetylcysteine is converted to help produce S-adenosylmethionine. So again, you keep your antioxidants under better control. When you think about supplementation of anything, we always have to look at what this is doing in our diet. So for most adults, somewhere around 56 grams of protein is required, is what you're told is required a day. And if we take these supplements, sort of as I've mentioned, then you can see that it's going to add up to 7 or 8 grams of protein, of additional amino acid or additional equivalent of protein. So therefore, to keep you from overdoing your daily protein, you'd have to reduce your protein from other sources. And while most of us don't think about this, it's something that needs to be kept in mind if you are going into supplemental of things along these lines. But once again, this is something you discuss with your physician so you know you're doing it the right way. There are other supplements that are available from a variety of sources. So these can come from plants and algae and fish. For example, the omega-3 fatty acids. Several years ago, a study showed that taking 5 grams a day of omega-3 fatty acids could allow people with arthritis to reduce what are known as the non-steroidal anti-inflammatories. So medicines like aspirin could be reduced by 1/2 by the beneficial anti-inflammatory effect of these. Other studies were shown that taking as many as 30 grams a day would help patients that have bipolar disorder and other psychoses to become more lucid. And so it tells us that these can be very beneficial in their effects. The problem is that's a lot of fat to take every day and makes most people very fishy feeling, and they burp a fishy smell, and their stool comes out smelling fishy. And so it's not easy for most people to do these types of doses of it. More recently, some studies have also looked at the role of the omega-3s. For example, there were benefits in heart disease shown years ago, but more recent studies say there was no benefit. And these contradictory studies like this are always difficult to wrap your head around, okay, which is real, which is true. And one of the dilemmas, and I'll point out in another slide later, depends on the dosing that you're giving. And if you design your study where you underdose for the supplement or the material you're giving, you'll produce exactly the result you want to have. So for example, if you don't believe omega-3 fatty acids are useful, you'll underdose in the study and show that they don't work. And that's an ongoing problem in many of these types of studies to think about. And so one has to read through and scrutinize the studies to verify that they're done appropriately. So once again, the amount of fat that we're supposed to take a day is up to about 70 grams. And so if you're taking 5 grams or more of omega-3 fatty acids, you have to reduce your other fat intake down or you'll be getting way too much fat in your diet. Another supplement, for example, St. John's wort, it has a chemical in it that's very similar to Prozac. The problem with trying to use it to treat depression is that it's not a regulated industry. And so you don't know what the actual dose in the St. John's wort is. So St. John's wort is not a supplement for taking Prozac if you have depression or one of the other medications used to treat depression. So you should never try to use these supplements if you're controlled on another medication that's doing the job it's supposed to, because you're dealing with an unregulated area and you don't know what dose you're really getting. And so pill to pill, bottle to bottle, you may be getting higher or lower doses of whatever it is, and that can wreak havoc with many disease states. Echinacea, for a long time, this has been said to help provide as a cold remedy. There have been many studies using it that have shown it actually provides zero benefit for helping with colds. Some of the studies, though, again, may be underdosed, and so are giving lower doses than what most people take when they're trying to prevent colds. This is a difficult one for me because my review of the studies suggests that echinacea probably does not provide any immune system benefit. But others will point out that the source of echinacea, depending on what actual plant it's coming from, may make a difference in a variety of other issues. So to me, this is the jury is still out a little bit, although I don't believe it provides much benefit. And when I talk to patients that have immune abnormalities, I point out to them, this is not a cure for immune deficiency. So this does not boost the immune system. It does not cure immune abnormalities. Ginkgo biloba is another supplement, and this one has been shown for many years and has been used in traditional Chinese medicine, and it does help improve circulation and improves memory. And studies have shown that supplementation with ginkgo biloba in older individuals can provide some benefit. One problem with it, though, is a few years ago when in New York, when they were studying different bottles to look to see what was in there, that what said ginkgo biloba did not contain any ginkgo biloba. So again, we're in that situation of buyer beware, that what you're buying may not actually contain what the label says. So other things that I sort of include in the supplements include things like DMSO. DMSO is an industrial solvent that you get from pines. It's not a supplement, but it's an adjunctive therapy that's utilized. It's a very anti-inflammatory. It's used by intravenous approach to treat inflammation. So urologists infuse this in individuals who are having severe inflammation of the urethra. It's used by the people that race horses on the horse legs every day because it reduces the tendinitis and inflammation of the legs to keep their expensive race horses running at their full speed. It's been used for a long time in athletes, but it's not FDA approved to treat any of the tendinitis conditions. So this is one where if one's using it to treat tissue inflammation, it's not approved for that. People there, when they use this, will start having a smell like garlic in their breath, and that's bothersome to some. Other ones, not so much so. And since it's a solvent, it can dissolve the dyes from clothing, so you have to be very careful. You can tattoo your skin by putting this on and then putting clothing like a pair of blue jeans on top of it. It pulls the blue dye out, and you get a patch of blue tattooed into your skin. So if you're using it, you have to clean yourself very well, put it on, let it dry before you put anything else on it where it might dissolve. Essential oils, this is something that has become blossoming as an industry over the last few years. And there's some truth to the matter. Frankincense is mentioned in the Bible. It's been used for thousands of years as a healing agent. Melaleuca, or teak oil, is very useful for such things as healing mouth ulcers. The problem with this is that the concentrates that are provided are extremely expensive. So a small vial of frankincense might cost $75 or $100, but they will tell you that you only need a drop at a time, so therefore it goes a long ways. But when you only have a few drops to begin with, it goes fairly quickly. You have to be very careful, though, is the purity of the material, what it says it is. Is the company reputable that's providing it? Or are they diluting it with something else that's not helpful, but still charging an exorbitant price for it? So this is something you have to be just very careful about. There's clearly benefit in some individuals from these. They've, again, been used traditionally for thousands of years and provide benefit, but one always has to be very careful. And if you're starting to use these to help with things, you might want to, again, discuss these with your physician to make sure that they agree with your approach to using such items. Probiotics. This is also a very big and important thing for most of us. This last Friday, I was at a conference where we were discussing the issues of the changes that have occurred in the microbiome as we're looking at designing new studies to help treat patients with autism. And so one of the problems is what lives in our body has changed since we think the Industrial Revolution began. And so trying to get back to what's more natural may be very beneficial for most of us. And so these are items that are felt to be beneficial that are found in a variety of the different probiotics. The freeze-dried components, the live components that are found in yogurt or kefir may be very useful, but most of the yogurt that's advertised doesn't have sufficient amount of the probiotics to be actually beneficial to anyone. Plus, many of the yogurts that are purchased that will say they have probiotics present have actually been pasteurized, so they've killed off the probiotics that are present there, so they're not, again, very useful even though they're advertising presence of it. Individuals that are on antibiotics that are definitely damaging their microbiota and their intestines may benefit greatly from supplementing with a variety of the probiotics. There have been rare reports of infections caused by the probiotics, and typically these are in patients that have cancer, that have received certain types of chemotherapy that have made their white blood count very, very, very low. And when I've reviewed some of these, I'm not sure that the patients were sick with the organism that they thought they were sick with due for a variety of difficulties in the studies. When we talk about patients that have immune abnormalities, these are most likely safe, but many of the people that treat patients with immune problems are concerned and will not recommend the use of probiotics. Fecal transplants, and so you may have read about these or heard about these in the news, and these have now been FDA approved. And so what they do is they take stool, they freeze dry it, and put it in little capsules for people to take. And this has been very useful to treat a condition called Clostridium difficile infections in the intestines. There's some evidence that it might help inflammatory bowel disease. And the goal is to restore a normal flora in the gut. And you see I have normal in quotation marks because the bacteria being used here are from individuals that are described as being, quote, normal. But as I mentioned earlier, our microbiota, what we have in our intestines today, may not be normal. We don't have the organisms that were here for thousands, perhaps millions of years, but we have organisms that have been come about probably since the Industrial Revolution when we started buying processed food, essentially. And so it's still probably not leading back to the full normal state, although there are benefits from it. We used to use this in patients with bone marrow transplant 30 years ago, and it's been known for a very long time that taking the bacteria from the guts from people that are not having illnesses can help the guts of people that are having GI-related illnesses. Something that's very interesting that, again, we discussed this last week is called helminthic therapy. And so what has occurred is that, again, for a very, very long period of time, that we had tapeworms in our body. And there are people that believe that we probably should have them there because we evolved in the presence of these. And so our system utilizes that information they provide to help establish the way our immune system works and other things about us. Most people now living in first world countries like the U.S. don't have many tapeworms in us unless you're in a rural area or you're not eating the right types of things. But using rat tapeworms that will last about 4 weeks in individuals before they die away, that if you give 20 of these to adults about every 3 weeks, that it has been able to provide benefit for a variety of what are considered to be neuropsychiatric illnesses. And so it's very interesting that it's doing something that's not well understood at this point in time that provides some kind of benefit. In patients that have relapsing, remitting MS, so multiple sclerosis, that it's reported that 90% of the patients that go on this form of therapy have improvement in their MS. And again, the reason this works is not very clear at this time, but it's a very interesting issue and situation. Chiropractic care, biomechanical disease can be helped, but other disease scenarios are not helped. Mock adjustments done chiropractic have shown no benefit. Acupuncture. Acupuncture also provides benefit. It's not understood how it works. If you're getting acupuncture, you need to make sure they're using disposable needles because there may be risks for infections. Hypnotism. Hypnotism works. The effects can rapidly wear off, though, so therefore people have to do multiple sessions to get some benefit from it. It's very helpful for a reduction of pain and anxiety in individuals. So let me conclude and go through a few things here. The placebo effect is very high. As many as 60% of people have placebo effects. So many things I've discussed here may provide benefit through a placebo effect, meaning not through actual benefit. The complementary and integrative medicine, there are a variety of approaches and modalities that may be beneficial, many different ingredients that may be involved, but you always have to be careful that you're getting what you think you're getting, and this can be difficult, and so you have to do your background work to make sure that when you're doing and buying these things, that you're getting what you think you're truly getting. And so if you remember, there's a movie several years ago, a cartoon movie with Michael Jordan, and all the cartoon characters, by getting water that was labeled Micro Secret Stuff, became strong and very good basketball players, and that was their placebo effect. Testimonials are not reason to believe something works. Many items are useful, though, but some can be harmful. And unfortunately, because we don't have a regulated industry for these things, that wrong chemicals or harmful chemicals may be in some of the products. Some supplements, like amino acids, omega-3 fatty acids, are part of normal diets, but increasing the amounts can be helpful. But too much may be harmful in some people that have metabolic disorders or kidney problems. So these things have to be worked through carefully with the physician before using those approaches. Minerals, vitamins can be helpful, but again, some can be toxic when taken too much. Many of these supplements may be useful, but unregulated industry, probiotics are good. Most people have no problem with them. Helmintic therapy appears to work in certain conditions, but it's $3,000 a dose, so most of us can't afford that. Chiropractic care, acupuncture, hypnotism can be useful as adjuncts to therapy. If someone's going these approach, you may want to include consideration of a naturopathic physician that's been certified or a traditional Chinese medicine person that is certified, but these should be discussed carefully with their physician and make sure that they are in agreement with what one should do forward with that. And so we want people to be healthy and not be harmed. And so thank you for your attention, and I'll be available to answer questions.
Thank you so much. We have time for a couple of questions. Anyone this side of the room?
There's one right here, if I can go first here. Just to make a comment, just as a matter of curiosity, and Doctor, thank you for providing us with options to continue conversations with our primary care physicians, because we're always looking for something when we're desperate, so, and we need information. So that's awesome. But as those of you know already, I'm a treating therapist at home when I go into people's homes, and I have 3 patients that have gone the route of fecal transplant. These were women in kind of 80s to 90s into their 7th round with C. diff, which is life-threatening at that stage in the game. And they went ahead with the fecal transplant. The collection, the harvest, was made from a family member that lived in the same home, as opposed to, you know, Jimmy down the street. And they had really remarkable results. And I have 2 patients that have used hookworms to address their irritable bowel syndrome with remarkable results, life-changing results. So I'm not recommending it, you know, not suggesting it, not endorsing it, just sharing anecdotally some stories. Anyway.
Isn't it true that most of our pharmaceuticals are natural in the sense that they come out of nature products, bark and such things?
So the question was about our pharmaceuticals that aren't they originally sort of natural? And the answer is yes, that there was something that has led to most of our pharmaceuticals from nature. Almost all the antibiotics that we have were found in soil bacteria. Some of them were not good. For example, there's one called cyclosporin A, which is a very poor antimicrobial agent, but very good immunosuppressive agent. But that was found in soil bacteria. And so the bacteria are fermented up and it's isolated from the fermenters. So you're correct. But many of these are modified chemically to provide more stability or longer half-life, or to try to augment their activities.
Yep. Do you have one over there? I have one here. Okay, we'll start.
You made the comment like sometimes when you go to buy something, say like at the drugstore or something, that you can't always count on what's inside the bottle as what the label says. How are you supposed to know?
There's a great question. That's why I wish I knew the absolute answer for that. And so for me, I try to buy something from a reputable. I don't buy an off-label. And if I'm concerned, I look it up on the internet, which is not necessarily the greatest place to find things, find the information, but to look to see if people are reporting problems with it. So I wish I had a better answer for you than that.
I'm Thomas Huber from the Charlotte area, North Carolina. Since this is your old state where you were active in, there is an institute in Kannapolis under Dr. Seisel who are doing a genetic makeup and then determine how much you have the dosage to be and what's really helpful and what's just not really helpful, because some of the medication and vitamins you can overdose. One of the things I really remember from his speech was that they're looking also at the salt affection on people with the genetic makeup, and 2/3 of you can actually eat as much salt as you want. It has no effect otherwise. The other third, better watch out.
Thank you for
I'm
the
afraid
comment.
this is going to be our last question. I hope Doctor will be available for questions.
Okay, thank you. One of the things I'd like to mention that I use is therapeutic massage. And one of the ones that I use that has been most successful is called Bowen work. It's B like boy, O-W-E-N work. I've had a lot of success with it. And a question about acupuncture. My acupuncture is done without a needle. It's more of a gun type thing. Do you have any thoughts on that? If that's
I'm not familiar with that. I've had acupressure, and I've know those that do acupressure, but I'm not familiar with the other.
okay. Thank you.
Thanks.
Well, thank you very much. And please join me in a round of applause for Dr. Harville.
Thank you very much.
Patient emotional support. Be your own advocate is going on right now somewhere. free. One more time, you just got me feeling so free. We're gonna celebrate, celebrate and dance so free. One more time, you just got me feeling so free. We're gonna celebrate, celebrate and dance so free. One more time, you just got me feeling so free. We're gonna celebrate.